Council and NHS officials have identified a site in Glasgow in which to locate the UK's first so-called drug fix room. The facility in the city centre would allow users to take drugs under supervision. Well, Suzanne Allen's been to the area to get the views of local residents and business owners.
This is a so-called fix room in Copenhagen, where addicts can inject heroin safely with clean needles. A site in Glasgow city centre has now been found for the UK's first such facility.
It'll be paid for by the council and the health board, who say it'll save money, costing just over £2 million a year. Users will be able to take drugs under supervision, but they'll also be able to access other services such as counselling, health and housing advice.
There are over 13,000 problem drug users in Glasgow. That's more than 3% of the city's population. 500 of them inject on the street. It's estimated each problem drug user costs over £31,000 every year.
Currently, injecting drug users are using in the city centre, in closes, in car parks, in alleyways, in public toilets, in business toilets. It's often a rushed act. It's often an act that results in injecting wounds and high-risk behaviours, for example, sharing of equipment and sharing of drugs.
Most users aren't in touch with drug services, and in the past 2 years there have been 90 new HIV infections among those injecting drugs. This is not a new idea. It may seem controversial, but drugs workers here say local people should not be worried.
I would say not to be concerned about such a facility. The evidence is there across Europe and the rest of the world as to how these facilities reduce public nuisance and antisocial behaviour, and certainly there's no evidence that they would actually increase it, so the public shouldn't be concerned.
The proposed area is a mix of housing and business. Local people are cautious.
I know that it's going to be local to here. We're a female-only business. We want to know what's involved, that we're protected. It's all girls that work here, and it's girls that come here, so we just want to know a bit more about it, what it involves.
Pros and cons, but probably a good thing overall, I think. I don't know.
It keeps the users off the street, cleans the streets from needles.
The drug consumption room would need a change in attitude by prosecutors before it could operate legally. It could open early next year. Suzanne Allen reporting, Scotland.